Good morning, good afternoon, good evening. It's my pleasure to give you a warm welcome to the whole of society approach to creating healthy, resilient, and sustainable cities, harness South cooperation for a COVID era training. This is a program that is joined between UNDRR GETI, UNOSSC, PAHO, and WHO. And as you know, this is a joint certificate training program, and this following minutes will wait just one more minute to some other participants to join in. Please stay connected. Again, good morning, good afternoon, good evening. We have close to 600 participants. We'll wait one more minute for starting the session. And I'll start with some housekeeping notes that it's important to you to know. And first of all, again, welcome to the training of whole of society approach to creating healthy, resilient, and sustainable cities, harnessing South cooperation for a post-COVID-19 era. This training will be primarily in English, but the simultaneous interpretation is provided in Arabic, Chinese, French, Portuguese, Russian, and Spanish. Please select the globe icon at the bottom of Geneva and 7 p.m. in Bangkok, and 9 p.m., 7 p.m. in Bangkok and 9 p.m. in Incheon. Today's session will be 90 minutes. It is important to mention that the participants have to complete the course requirements since they are entitled to receiving the certificate of completion. And it can be achieved through attending at least 3 or 4 live sessions. It means 75% of attendance. But also very important to remind you to complete a feedback survey and a final exam. Both will be made available after session 4 on the training on the virtual training platform from 27 June, and you'll have until 5th of July to complete both survey and exam. Please note you will only have one attempt to pass the end of the course exam with a score of 80%. Format of the final exam will be a multiple choice test. Also, to ensure your attendance is collected, you must join the training via the learning platform. And as you know, attendance is auto-collected as participants sign into the platform. So make sure to sign in using your login, or else your attendance may not be recorded. Your video and microphone will be disabled for the training. As you know, the chat box is open to allow interactions with you, with all the participants. Now we are close to the 800 participants, and we are really, really pleased to see this. So please respect each other and refrain from posting self-promotional materials or discriminatory messages. We may disable the chat box should it is misused. And also you'll be refrained and get out of the training as well. Encourage participants also. We want to encourage to all the participants, to all of you, to ask questions by posting them in the Q&A box. And we'll try to answer as many questions as possible during this session. So let's begin. As I mentioned before, today is the third of 4-week training. It will last 90 minutes. The session's primary focus today is on whole of society in urban health disaster risk management from theory to practice. My colleagues will address the following aspects, like frameworks, key concepts, and tools on health emergency and disaster risk management in the urban context, and the relevance of the inclusion of persons with disabilities. The whole of society and whole of government approach to reducing risks and impacts of emergency and disasters, multisectoral coordination, and also the role of youth in health emergencies in disability inclusion in disaster risk management. We are delighted to start the session with a message from WHO Director General, Dr. Tedros. We also have the pleasure of introducing 4 speakers that are with us today, who will share key information and guidance on managing risk, disaster, and health emergencies, and the importance of the whole of society and government approach to face future crises and hazards. My name is Alex Camacho. I'm the Regional Advisor for the Americas on Emergency Preparedness and Disaster Risk Reduction, and I will be co-moderating this session with my colleague, Adam Tiliouine, who is a Technical Officer in WHO headquarters. Good morning, Adam. Welcome also to you.
Good morning, Alex. Nice to see you.
Thank you. So first, we'll start, as mentioned, with a short video and a very important message from our Director General, Dr. Tedros Adhanom, the Director General of WHO. Please.
Dear colleagues and friends, WHO is delighted to work with our partners across the United Nations for the 4th year in a row on this training program. It uses the lessons we have learned from the COVID-19 pandemic to provide guidance in managing complex risk and to help cities become healthier, more sustainable, and resilient. 2023 marks the midpoint in the implementation of the Sendai Framework for Disaster Risk Reduction and the Sustainable Development Goals. While progress has been made, there is still much more work to do. This course has a particular focus on engaging at-risk groups such as women, youth, and persons with disabilities. Inclusive governance and whole-of-society engagement are critical for building resilience. We're proud to join together with the United Nations Office for South Cooperation and the United Nations Office for Disaster Risk Reduction on this important work. I wish you all a fruitful engagement with this important material. I thank you.
Thank you, Dr. Tedros, for this really very important message. And now I'll have the pleasure to introduce the panelists. We have a very important panel today, and it will be followed by Harbou, who is the Technical Officer for Disaster Risk Management and Resilience from WHO, Ludy Suryantoro, the Unit Head of Multisectoral Engagement Corporate Security. We also are delighted to have Natalia Gomez, member of the UNDRR Committee for the Latin America and the Caribbean. And I'm very, very pleased also to welcome my colleague and friend, Juan Ángel de Gouveia, President from the Latin American Network of Organizations of People with Disabilities and Their Families, RIADIS. Please, let's begin. I'll now give the floor to Harbou, Technical Officer for Disaster Risk Management and Resilience from WHO. The floor is yours.
Thank you. Thank you very much, Alex. And thank you to all the co-organizers for the opportunity to participate in this very important training and to give you a brief presentation on some of the key concepts of health emergency and disaster risk management and the whole of society approach related to resilient cities. Next slide. And by way of the context, I think you have heard already a lot in the previous sessions where many of the complexities of this topic were very well outlined, and also in the opening remarks where Dr. Tedros alluded to many of the very important aspects. Of course, urbanization is one of the mega trends of our time, and urban areas, especially in low and middle income countries, are one of the main domains we have to focus on in our efforts to bring the risk management approach down to the subnational and community levels. And this is also reflected in the selection of targets of the Sendai Framework for Disaster Risk Reduction and the Sustainable Development Goals. And some of the main challenges for building risk management and resilience that need to be addressed in this context are, of course, unplanned urbanization, the high population density, and the often large number of population groups with very different vulnerabilities that we heard about already as well. One of the key underlying factors to build resilience is the capacity of cities to implement risk-informed governance systems and to conduct and implement strategic and long-term planning. And I will talk a bit more about this in this presentation. And another mega trend that we have seen in light of the COVID-19 pandemic and also in light of disasters related to natural hazards is that increasingly countries and cities have to simultaneously deal with multiple concurrent emergencies that affect their communities. And this is particularly important because such compounding emergencies can have exponential impact, in particular on vulnerable populations. And this is why it is so important to prepare, for example, for the dual impact of a disease outbreak and other types of disasters, as well as for concurrent emergencies, for example, in the setting of an ongoing protracted humanitarian emergency. And I think it is only reasonable to expect that this landscape of converging crisis will evolve even further with the emerging risks associated with climate change, which is contributing not only to more frequent and more intense climate-related disasters, but also driving displacement of populations. Next slide. And all of these aspects really underscore the need to invest in emergency preparedness, addressing a broad scope of hazards, and by addressing underlying vulnerabilities faced by communities through multisectoral and whole of society mechanisms, and moving away from the focus on a reactive response to a single event and single hazards. And to support countries in adopting such a comprehensive approach to risk management, WHO has developed the Health Emergency and Disaster Risk Management Framework, which describes the core functions and components that allows governments and stakeholders to manage risks collectively at all levels of the health system, from policies, strategies, and legislation to planning, coordination, human and financial resources, information and knowledge management, and other key components. Next slide. And this HEDRM framework brings together the international health regulations, the Sendai framework, the Paris Agreement on climate change, and other important regional and global policy frameworks towards the Sustainable Development Goals. And it provides a common terminology and a common language and a comprehensive approach that can be adapted and applied by all actors within health, but also from other sectors who are working to reduce health risks. And this is in particular important as it facilitates the involvement of all sectors and the management of critical interdependencies between them, between these sectors. And this is particularly prevalent in the urban setting. Next slide. And we have seen in many emergencies how important this joined up, coordinated multi-sector response is, and that there are mechanisms in place that enable decision-making on response actions that go far beyond the health sector. For example, when we talk about measures that affect livelihoods, businesses, economies, and especially also the continuity of essential services. Because while the health sector leads the management of infectious risks and the response to disease outbreaks, it of course also has a critical role in preventing and minimizing the health consequences of emergencies due to other hazards, be it natural, technological, societal, etc. And this is why we need to systematically strengthen the intersectoral collaboration between health and disaster management and institutionalized mechanisms for the health sector's engagement with whole of government mechanisms, such as national disaster risk reduction strategies. And beyond the government, preparedness for emergencies also require coordination and collaboration with civil society, academia, the private sector, media, etc., down to individual community members and many other stakeholders. And this is what we mean by a whole of society approach. And WHO has published guidance on how countries can develop or adapt integrated strategies, plans, and mechanisms for emergencies following this approach to ensure that all efforts across the different agencies and entities and stakeholders are towards a common purpose. Next slide. COVID-19, but also other recent emergencies have also shown us that we need to better understand and manage systemic risks and to follow risk-informed and evidence-based approaches. And for this, a critical first step is to conduct a systematic risk assessment to establish a joint understanding of the priority risks that a community is facing and that the community needs to prepare for. This is why, building on the Health EDM framework, WHO developed a strategic tool for assessing risks, the STAR tool. This tool that you see here was published in 2021, and it provides an easy to use and a comprehensive methodology to conduct an assessment of public health risks for planning and prioritization through an all hazard and multi-sectoral and participatory approach, to describe and rank risks and to recommend appropriate actions to prevent, prepare for, and respond to emergencies resulting from these risks. Next slide. Another important step in operationalizing whole of society health EDRM at the national and subnational level is the development of multi-hazard emergency response plan. Based on the results of the strategic risk assessment, these plans define the roles, responsibilities, accountabilities, systems, mechanisms for initiating and managing a health emergency response. And WHO published guidance on the development process and the recommended key components of such a plan. And maintaining a multi-hazard emergency response plan is a key preparedness capacity at the country level, but equally applies to cities, as it makes a response more rapid and predictable and allows communities to act in a more anticipatory manner and ensuring the most effective use of limited resources. Next slide. To implement risk management at the local level, which applies, of course, in particular to the urban context, health emergency and disaster risk management focuses on strengthening local health workforce capacities, along with inclusive community-centered planning, which we just spoke about. And in this context, the framework highlights these key community functions you can see on the slide. And WHO is offering support in all these areas, from community engagement, health promotion, to community health services and support networks, etc. And many of these can be implemented through primary care and public health services, and in particular through joint actions with other sectors. Because what we have to keep in mind is that people in communities already participate in whole of society action every day of their life. At the local level, especially in the urban context, these linkages between health, education, transport, water, law enforcement, emergency services are much more evident than at the national level. Next slide. There's quite a number of other actions underway to operationalize health EDRM, but I hope in this very short presentation, I was able to outline some of the key risk management measures and approaches to build whole of society strategies and plans at the city level. This is a key factor to build the resilience of health services and protect communities from the impacts of all types of health emergencies, including the impact of climate change. I think I leave it here. I will share the links to the WHO publications I mentioned in the chat, and I hand it back to you, Alex.
Thank you very much, Kai. So next, we are going to move on to the next presentation from WHO. So I'm pleased to be able to hand the floor to Mr. Ludy Suryantoro, who is the unit head for multisectoral engagement for health security here at the WHO headquarters. So Ludy, for the next 10 minutes, the floor is yours.
Thank you very much, Adam, and then good morning, good afternoon, good evening. So allow me to introduce myself. My name is Ludy Suryantoro. I'm the unit head for multisectoral engagement for health security preparedness department in the headquarters. In a few minutes, I will present you what exactly that WHO is doing in the context of urban preparedness initiative, particularly a presentation on a prepared city for a responsible city, strengthening urban health emergency preparedness in the face of future health threats. Next, please. As my colleague Kai has already highlighted the importance of multisectorality in addressing future public health threats, multisectoral preparedness coordination is vital. WHO is committed to enhance and advance the multisectoral preparedness coordination. As you know very well that many documents and many guides and tools is explaining about the importance of multisectorality. However, it is very challenging in concretizing multisectoral collaboration. In this context, WHO is committed, and we have developed several publications on multisectoral preparedness coordination, such as the MPC framework. This framework is highlighted to sectors beyond health sectors, the need that we need to think out of public health in order to have a better solution, a better output and better way on how we can manage future public health threats. This includes strong collaboration with the finance sector, foreign affairs, interior, and urban, of course, is recognized as one of the important aspect based on the past and future, experience, particularly engagement of local authority. Now, in the face of disasters, risks, or natural disasters, emergencies, as you know, that the two sectors play a very important role, such as civil and military. And WHO has developed the National Civil Military Health Collaboration Framework for strengthening health emergency preparedness. In this context, it is a guidance document of which we hope to, the two sectors is really building a collaboration, not necessarily just collaborate within the crisis, but beyond the crisis, meaning the preparedness era. And of course, I'm very pleased, and in this context of presentation, we have also established a technical working group on the publication for WHO framework on strengthening health emergency preparedness in cities and urban settings. Finally, in order to have to make sure that all effort on public health emergency preparedness can lead towards a national investment, we are also engaging with the parliamentarian, of which we also translate the IHR benefits for the parliamentarian to understand better on how they can contribute to the public health emergency preparedness in the future, particularly in the context of International Health Regulations 2005. Next, please. So this slide just to illustrate a little bit about where we are in terms of WHO commitments in engaging other sectors beyond health sectors, including the non-traditional actor. So as you know very well, we have already established a civil-military collaboration framework. We have provided a handbook for the parliament to understand what they can contribute to the implementation of IHR, particularly also addressing disasters risk management, finance and trade. We also in the process of establishing innovative financing, sustainable financing for public health emergencies, and of course the city and urban preparedness that is currently ongoing. And of course, the human, animal, and environment interface plays an important part in the future of infectious diseases emergencies. So this One Health concept has been widely recognized by many countries as the fundamental issue that we should address in the future. Of course, in the future, we are dealing on other sectors such as collaboration between Ministry of Health and Foreign Affairs, of which proven to be an important area of collaboration because of the two different missions of public health and foreign policy. And finally, the public-private collaboration where technology, where innovation can come together to address future public health emergency. Next, please. So in the context of urban health preparedness, urban environment have a very unique vulnerabilities and risk profile, given their characteristic, including high population density and associated congestions, as well as being hub for travel and trade. Urban environment and their design, building local level capacity and integrating local municipal authorities into national health security preparedness activities are critical in mitigating this risk. And also, given the importance of this urban context to the health security, national health security and emergency preparedness cannot be achieved without an enhanced focus on cities and urban setting. COVID-19, moreover, is proven, and we know that provided a lot of lesson learned, a unique challenges and opportunity has been identified on how cities and urban face a lot of challenges, but it's also an opportunity that we can address better in the future. As you can imagine that the high proportion of the last COVID-19 cases and deaths and community spread occurred in the dense environment, particularly cities. Next, please. So I would like to highlight a little bit about where is the mandate under the WHO. So last year, WHO member state has adopted a resolution, the WHO 75.7, of which this resolution is focusing on strengthening urban health preparedness, emergencies, and response, specifically in cities and urban settings. Now, in the context of WHO Assembly, we normally, when we pass the resolution, it requires a country champions or country who are sponsoring for the resolution itself. In this context, we have all WHO regional office in terms of country who are sponsoring this resolution, such as Botswana, Colombia, Ecuador, Jamaica, Mexico, Peru, United States, America, Saudi Arabia, United Kingdom of Great Britain and Northern Ireland, Indonesia, Thailand, Brunei Darussalam, China, Japan, Malaysia, Republic of Korea, Singapore, and Vanuatu. And what is important in this resolution, the discussion between member states, it does not matter whether it's developed countries or very advanced cities, or a middle income countries or a medium type of cities in the world. I think during the COVID-19, it was proven that everyone has their own challenges. But it is recognized that each city creates a success story. They have a solution that they can share in the future. And most importantly, on how we can enhance our collaboration at the city level, at the local level, closer to the community, and ensuring of mitigation process in the future, particularly on the disaster risk management. Next, please. So what is our strategy in WHO is on the urban preparedness, particularly in strengthening local capacity for health emergency preparedness. So we would like to highlight that normally WHO role is really focusing at the national level. We provide global guidance, standard, and we do have a legal framework called the International Health Regulation Framework, in particularly supporting country capacity in building their activities at the national level. As I previously mentioned that since WHO member states has passed the resolution and request the Secretariat to address emergency preparedness, with the WHO 75.7, we are now implementing the Urban Preparedness Resolution. Now, this is providing an opportunity to break through from the local level and to maximize our efforts from national, subnational, and local level. It is also contribute to the process of what we call it country core capacities, where WHO has a process to support country from the assessment process, from building and developing national action plan, costing it, mapping it, the investment, but most importantly, there is the new process in the future called Universal Health Preparedness and Review on how all countries and all solidarity can be built together in the face of the future public health threats. It is also building momentum and trust solidarity for health security. As you can see, every local authorities provide different types of guidelines during the public health emergency. So what we need is to make sure everyone in the same page in terms of how we can mitigate the situation. What are the lessons learned? What are the solutions? What sharing best practices each city can provide? So, and finally, it is our mandate to ensure that every country that we can support in terms of the IHR capacity and capability development in this context is aligning between national and subnational and local in terms of their tools, they guide, but it's also approaches on cross-sectorality in these three levels that that is required to address future public health emergencies. Next, please. So as I said, we have a two strategic prong under the urban emergency framework. This is ensuring that there is an integration of local and municipal authorities and actors into ongoing health emergency preparedness processes and activities delivered by the WHO. At the same time, we need to make sure that we can support and build capacity at the local level. So one is about the alignment between local, subnational to national. Others than that is also adapting from national to subnational and local. So it's a two strategic prong that ensuring that we are all in the same page. Every level of the government are providing activities or implementing activities that is aligned as based on what the WHO recommendation under the urban preparedness framework. Next, please. So if we are talking about urban preparedness, within WHO, it means that there are a huge cross-cutting area of work. So in this slide, it gives you just a slide, information that what are the key categories and areas of work that we are focusing on. So we are addressing the One Health and human-animal environment interface. As you can see in the future, the amount of transmission of disease from animal to human is very focused in cities because of the densities, because the changing environment, because the number of wildlife is coming to the cities instead of because of deforestation. The second is infrastructure. We need to make sure that we should address, all the key necessary compliance of infrastructure for disaster risk management, including infectious diseases. As pandemic does not recognize border, point of entry required a very specific activities that we need to require all those cross-sectoral authorities from the port authorities, the airport authorities, and the ground crossing authorities to work very closely with the public health emergency. Data surveillance, as you can see that between data surveillance at the national level, sometimes tends to be different at the local level. We need to make sure that the data surveillance will use the same, or there will be an interoperability of system between data and surveillance that took in place. The rest, disease specific, it could be, influenza, respiratory pathogen, the antimicrobial resistance. There's another big threat, but it's also, all the risk, natural disasters risks that every city is facing, such as flooding, such as earthquake, and other the unexpected, and for the cities to face in the future. So these are the relevant, just to give a good example, it's not limited to this, but it is just to highlight a little bit what we are doing within WHO in collaboration and discussion with our member states. Next, please. So we do have an existing public health emergency preparedness framework for urban in terms of tools and guides. So we do have a technical publication on the Global Technical Working Group on the Urban Emergency Preparedness, of which this technical working group is preparing for the development of the framework itself. We also has published the guidance in terms of health emergency preparedness in cities and urban settings. This is particularly for the national and local authorities to collaborate together. During the COVID-19, we did an interim guidance for local authorities on how they should respond to or prepare for a further deterioration, the challenges under the COVID-19. But it's also, we provide a practical action in cities and urban setting in terms of a checklist for the local authorities to actually being more prepared for the COVID-19 pandemic. In the context of partnership, we do have collaboration with the Global Sustainable Preparedness Support Network. This is a multidisciplinary network that is working to support countries to address their health preparedness, health emergency preparedness capacities and capabilities. We are also will be launching this Global Prepared Cities platform based on the request of the member states under the resolution for focusing specifically on health emergency preparedness in the future. Others, of course, we are trying to comply to the international health regulation implementation, including different activities under the health emergency program. We have STAR, as you know, this is about assessment on risk assessment, including natural disasters and disasters risk assessment that every country can have, but it's also at the city level that we can adapt it better. Next, please. So the framework has, cover about the role of the cities and urban setting, but we identified key areas of work or key areas of pillar important in cities and urban setting. This is including of the governance and financing, multisectoral coordination for preparedness. Once again, it is a different type of level of cross-sectorality within cities and urban setting. High population density and movement, community engagement, group at risk of vulnerability, evidence and data information, commerce and industry and businesses, organization and delivery of health and other essential services that is required in every city. This complement with our existing effort on risk assessment that is already available, but is adapted to city, monitoring evaluation framework that is also available, and the capacity building and partnership that we continue to be committed to support all levels of the government in ensuring and improving the health and emergency preparedness in the future. Next, please. So strengthening health emergency preparedness in city and urban setting guidance, it is an operational guidance document. It is to support the implementation of the framework itself. This guidance is based on key challenges across the 8 key areas that I mentioned earlier as identified as a key priority by our technical working group. It is also suggested approaches and action in each area and also cross-sectoral area at national level and the local level, including the engagement of each authorities in this level. It is not, a very fixed framework, but it is a starting point of the conversation because when you talk about urban preparedness, it will be no other boundaries, but this is just to highlight the beginning and the contextualization on how we can support in the preparedness area, particularly in the urban and cities areas. Next, please. So I mentioned earlier about the partnership and the important partnership. So the GSPN is a process where WHO is supporting country. I mentioned earlier, we have our obligation to support country in assessing their risks, in evaluating their capacities and capabilities, supporting them in developing the national action plan, and then mapping those national action plan through different ministries that would considered as relevant or important to contribute to the common national plan. But this then also required a technical support, meaning an expert. So the GSPN is mobilizing this technical partner institution, and particularly with the urban experience and expertise to support city authority on how they effort to build their capacity in the context of global prepared city. So in the future, based on the resolutions, there will be city-to-city collaboration in the context of health emergency. As you know, during the COVID-19 data sharing, best practices, from instance, the success story in Caribbean could be very useful to the Pacific Islanders. How Cape Verde can inspire Timor-Leste. This would require building a community of practice, and hopefully in the context of city network, we can engage, we can listen to, we can hear what a community solution, how can we empower the community, and how this framework can be supportive of their effort in building their capacities and capabilities. Next, please. So this is my last presentation. So my last key messages is that urban setting provide a lot of opportunity, but continues in terms of facing new challenges, either environment that will lead to the natural disasters, new viruses that is coming in the future that require because of the changing environment that would affect the transmission of diseases. To this end, we continue to committed and working with our partners in the UN, including UNDRR, and then hopefully this information and knowledge transfer will be useful for you to understand better on what is WHO endeavor in the future, and we plan for continue to support countries at all levels, national, subnational, and local levels. Thank you.
Thank you very much, Ludy. So we have
感谢 Ludy 您的演讲。现在我们已经看到有超过1200位的参与者加入我们的会议。我们在我们的活动结束的时候也会有简短的问答环节。现在我们想邀请下一位讲者，他是娜塔莉亚·戈麦斯，他是拉丁美洲与加勒比地区青年减灾委员会成员，他也有参与过 联合国环境署的项目，同时也是在气候变化适应以及相应的风险方面的工作。
The NDC Partnership Youth Working Group, the development of the Youth Participation Plan, and was co-founder and president of the Costa Rican Youth and Climate Change Network from 2019 to 2022. Currently, she's a member of the Youth Committee for Disaster Risk Reduction of the Americas and the Caribbean, youth advisor of the Global Center on Adaptation, and special advisor on youth to the Commissioner for International Partnerships of the European Union. So it's fantastic you can join us today, Natalia. Thank you so much, and I'll pass over to you.
Muchas gracias por la presentación.
Thank you very much for the presentation. I am going to make my presentation in Spanish. As I have mentioned already, I'm going to mention a bit about my experiences in youth and disaster risk reduction, mainly as a member of the youth board for the reduction of disaster risk in the Americas and the Caribbean. First of all, the contextualization of why youth population up to 30 years of age pretty much make up almost half of the population of the whole world. So when we talk about young population, we understand these populations from 10 years of age who are adolescents up to 30 years of age or up to 35 years in some countries, as some Latin American countries and African countries. So we're going to focus on this presentation in participation and the importance of participation of youth and also of children and adolescents. So we have that also around 1 billion girls around the globe are living right now in places that are highly impacted by climate impact. And we have at least one child out of 4 are living in conflict areas or in areas that are impacted by disasters with limited access to medical conditions, to education quality, to access to nutrition conditions, good quality nutrition conditions. We have also that millions of children are in displacement situations around the globe, and this is all exacerbated by factors which increase the risk as poverty, as inequality, as water crisis, as inoperable governance, political instability, environmental degradation, conflict. We have also seen an urbanization with no planning and also policies that are not taking into account information about risk as well as ecosystems. And this, if we relate it also with threats as extreme weather conditions, climate change, and also the growing trends at an environmental, social, technological, biological level put children, adolescents, and youth in high risk conditions. So we've come across that also these actions which governments are implementing, different stakeholders for risk reduction, for facing climate crisis, and also to contribute in the sustainable development agenda, and its majority are going to affect the living of youth and adolescents, which is why it is very important that they are taken into account in the decision making. Now, what is the role of youth in the disaster risk recovery? We can frame them in the Sendai framework where we have priorities, and in all priorities there is influence of youth. Since whenever we understand risk, it is important that this risk understanding takes into account also how risk affects adolescents, youth who have a differentiated impact. And also in governance processes, it is very important that voices and insights of youth, of children, and adolescents are taken into account in their strategies, in the working groups, in the advising groups, and in the governance stakeholders. Now, in regards to the third priorities, we have that youth and adolescents have actions which can be executable at the level of schools and homes, in which they're and then that's the reason why they must be taken into account in the decision making, in the design, implementation, and of disaster risk recovery strategies. Now, in regards to priority 4, youth and children have a role in the response in regards to disasters. That is why they must be included in this preparedness and training processes. That's why we see that youth have an important role in the whole disaster risk recovery cycle, so from assessment, prevention, and mitigation, as well as preparedness and response, and also in the last stage, which would be rehabilitation, rebuilding, and all of this at different levels. At the local level, in our communities where we have these local community boards of youth, as well as up to a national level where there are structures, there are policies, national risk management plans, or at an international level where we see the Sendai framework agenda, and also all these negotiations in regards to the climate change. And youth also have a role in these discussions. So 4 key points in regards to the role of youth. The first point is they're a key stakeholder because they bring different perspectives, insights in the designing of policies and planning processes in DRR, as well as in governance structures. And unfortunately, in many situations, we see that this governance in the DRR, or these local communities, these local boards for emergency care, in very few cases, they engage youth. And then also youth are a bridge stakeholders, bridge actor, we could say it that way, because youth have a role doing this linking between scientific knowledge and technological knowledge, between innovation and knowledge of communities themselves who are part, as well as youth have a role in bringing new solutions and including innovation in science, technology to face disasters and to reduce disaster risk. And also, we are implementing actors in different communities at the community level, at household level, at local government levels, and also nationwide. And here there are some points that represent youth. This is a case of youth of the Americas and the Caribbean, where prior to the regional platform for disaster risk recovery of 2021, we had a survey. We did a survey in regards to what were the perceptions of youth in regards to climate change and disaster risk recovery. And it has been evidenced that youth have experienced different threats, mainly strong rains or rainfalls in the Americas and the Caribbean. However, the majority do not know the disaster risk reduction strategies at a community level and also nationwide. But we also have that the majority have either not participated or currently participate in the community, national, or regional strategies in disaster risk recovery. And most of them believe that they can contribute to improve the social, economic conditions and the recovery in our countries and communities. And also here, I have some other results of the survey that was performed in the midterm assessment frame, in the Sendai framework in the Americas and the Caribbean, where we have that most youth or most of youngsters in a different survey, they mentioned that they do not know about this assessment or the Sendai framework. They also mentioned that our countries do not have the capacity to respond to these meteorological or weather threats. And most of them mentioned that they have the lack of knowledge on how to respond to a disaster risk and what actions to to implement in regards to this disaster risk recovery. So the main answer was include children and youth in disaster management strategies. We also have resilience. So here we have the solution, and it is very important that in these phases, youngsters are taken into account as one of the strategies to improve this response capacity, the application of and establishment of laws. And also here, they are the main measures or strategies that were voted to improve the action capacity in regards to risk management. One of them is to ensure compliance of regulations and laws, training, and include children and young people in this knowledge campaign. Also, then people were also consulted if they felt that they a comprehensive part in the disaster risk recovery, and the majority answered that they do not see their needs are reflected in the public policies, that they do not participate in these related activities, or also some other people answered yes because they prepare themselves and also in their communities. On the other hand, young people were consulted if they consider that youth are a group in vulnerability conditions, and they mentioned that yes, some reasons are because of employment, because of difficulties in employment access, and also because they are in an educational training process. However, more than mentioning children and youngsters as a vulnerabilized group, youth must be recognized in the decision-making processes, in governance, training, and actions and disaster risk reduction as a stakeholder, as a key stakeholder with different skills, and also as a trigger of change and as a broad group of the society that, as we saw at the beginning, great part of the makeup of population is young people. So beyond a vulnerable group, it is important to see how youth are part of the civil society. So some opportunities and main recommendations are to safeguard this participation of youngsters and the presence of different voices. Participation spaces for children and youth are very little and not always safe. So these spaces shall increase at different levels, at a local and national level, and also at an international level. And also people who are here have an influence on this, or and then it is important to be a knowledge baseline and to make sure that we strengthen those capabilities to assure a participation in an informed decision making, more opportunities, more research and technology for disaster risk reduction or recovery. And this has an importance. There is limitation in access to technology. Also, youngsters have a lot of ideas, a lot of innovative and new ideas. There's a lot of science that's been generated at the academic sector, a lot of youngsters in the communities bringing innovative ideas and solutions. However, many times they are not taken into account because of lack of capacity or lack of financing. And it is worth mentioning that there may be financing, however, it is not accessible for youngsters. And mainly when we talk about young people, it is important to have young people presence, because many times in public policies, they are actions who have to do with youth. However, youth are not even consulted upon. However, um, it is important to do regulations for youngsters, keeping into account youngsters, assuring that comprehensive participation in decision-making process, in the design of policies, and the governance structures, supporting young people, professional young people in disaster risk recovery or reduction, so that they have more capabilities and support the execution of actions from young people for young people. So to wrap up my intervention, I also have the experience of the Americas and the Caribbean, where we have been in 2020 or since 2020, previous efforts seeking a way of higher participation of youngsters in the disaster risk reduction. We started in 2020 with surveys. Okay, what were the perceptions of youngsters? Indeed, it was some of the results that we saw. And then we had a forum in 2021 prior to the 7th regional platform in Jamaica. And then youngsters launched the Declaration of Youth of the Americas and the Caribbean in regards to the disaster risk reduction and what the priorities are. And then starting from this process, also a global youth platform is made up in climate in resilience and climate action in midterm of the Sendai framework. And then in 2022, last year, we had the resilience take, which was a early alert lecture where we had around 20 proposals in early alert for the Latin American region. And the purpose is also that these kinds of initiatives are kept on time. And then in 2023, between the end of 2022 and beginning of 2023, we had meetings of young people for the preparation of a youth action plan and the disaster risk reduction and the governance in the youth network and disaster risk reduction in the Americas and the Caribbean. And then right now we are in the development of this network and what is the governance going to be like and how we're going to promote the participation of youngsters throughout the risk management cycle. So part of the regional platform for disaster risk reduction, which was held this year in Uruguay, part of its efforts was the presentation of the Youth Declaration, which was about what were the action plans um, options, which are focused in 4 main strategies, starting by uh, education, science and technology, then strengthening of capabilities, inclusion and participation is the 3rd area, and the 4th area is investment. Now, starting from this action plan, one of the main objectives is the creation of the youth network for the disaster risk reduction with the aim of promoting the building of capabilities and the mutual cooperation between youth of the Americas and the Caribbean, and also to do exchanges with youth of the African continent region, of the Pacific Ocean region, and different regions of the world, and also to do political advocacy in different disaster risk reduction strategies under a gender inclusion, gender equality approach, an intercultural approach, and also an sectorial approach. So this is an effort of the Americas and the Caribbean, and we also have resilience in the early alert system. And finally, key recommendations, which are also part of the action plan of youth in regards to innovation, science, and technology, to create and keeping the spaces so that young people can bring new ideas in regards to early warning systems and actions for DRR and the knowledge generated in communities, in the academia, in our societies, with a society perspective and with awareness in regards to the vulnerabilities of each country and each region, and then strengthening of capabilities or capacities building. It's important to facilitate spaces for strengthening of capacities of young people and also of community stakeholders, and very important, the communication and dissemination strategies of information in regards to disaster risk management, which in many opportunities policies and plans are at a different scale, and if they don't reach youngsters and communities, inclusion and participation is important to strengthen the meaningful participation of youngsters in decision making. And finally, investment. Here there are some resources. These are some studies that were done with UNICEF, and this is my participation. Thank you very much. Let me leave my contact here. Here's my contact. Thank you very much, Natalia.
So now I'll give the floor to my friend and colleague, Juan Ángel de Gouveia. Juan Ángel is the president of the Latin American Network of Organizations of People with Disabilities and Their Families, RIADIS. It is important to mention that RIADIS is one of the most important organizations of the social services in the Americas and perhaps in the world. Juan Ángel, you are very welcome. Big hug from Washington to you now. The floor is yours.
Thank you. Good morning. Thank you, Alex. Good morning, everyone. My name is Juan Ángel de Gouveia, as Alex mentioned. I am the RIADIS president. I am so glad to be here. May I have my presentation, please? Great. Could you please put it on presenter mode? Yeah, great. Next, please. Since we are out of time, I am reducing my presentation. I'm talking about the Sendai framework for disaster risk reduction 2015-2030 that established that it is urgent and essential to anticipate disaster risks, plans, measures, and reduce them to protect people. Furthermore, risk reduction practice should have a broader preventive approach that considers multiple, multisectoral, inclusive, and accessible threats. Next, please. These are the subjects covered: the Sendai framework, the inclusion in DRR, the UNDRR, the inclusion for disaster risk management in hospitals, and the partnerships for DRR. Next, please. Okay, here's what I was saying about the Sendai framework. Next, please. What our guiding principle? This disaster risk reduction requires the involvement and collaboration of the whole society. It also requires empowerment and inclusive, accessible, and non-discriminatory participation, with special attention to people disproportionately affected by disaster, particularly the poorest. This inclusive approach aims to reduce risks that disproportionately affect vulnerable populations, particularly people with disabilities, due to high rates of mortality, morbidity, and impact in disaster situations. Considering that people with disabilities are generally excluded from policy formulation and disasters risk reduction management plans, their vulnerability deepens and the response to victims after a disaster becomes more challenging. Therefore, effort must be made to include people with disabilities and their families in disaster risk management, with a greater emphasis on emergency and disaster preparedness, especially in critical sectors such as healthcare. Next, please. It is essential to have healthcare facilities whose services remain accessible, operational at their maximum capacity, and within their own infrastructure immediately after an emergency or disaster. This implies that healthcare personnel must be prepared to respond to all types of threats with the premise of leaving no one behind, which includes workers, patients, also with their families, victims of an event, and anyone within the facility. Additionally, healthcare facilities must facilitate the autonomy of people with disabilities within the infrastructure by complying with universal accessibility and universal design regulation. It is important to have consultation plans for to have the OPDs within these plans. Next, please. What is the role of organization of persons with disabilities in the DRR settings? There must be a consultant arrangement for organizations of persons with disabilities in different countries. You may see in my presentation that it is highlighted in yellow. Yes, this is the most important thing there for people with disabilities, and the necessary training so that they can be part of the processes of construction policies and tools in disaster risk management. In this context, and in contribution to the efforts made by countries in the health sector of effectively complying with Article 11 of the CRPD, situations of risks and humanitarian emergencies, this document presents a methodology to promote inclusion in disaster risk management in hospitals, paying attention to the needs of people with disabilities. This methodology is called Inclusion for Disaster Risks Management in Hospital. Next, please. This is the UNDRR. The Inclusion for Disaster Risk Management in Hospitals is an assessment action methodology to improve the level of inclusion of people with disabilities in disaster risk management in healthcare, particularly in the preparedness and response of hospitals and emergencies and disaster. Although this methodology places a special emphasis on preparedness for disaster response in these hospital environments for people with disabilities and organizations, the inclusive process with which its methodology was developed is of great relevance, since it constitutes a guide for other similar processes. Next, please. Now, let me talk about a little about the implementation of this INGRID, INGRIDH, is achieved through a methodological cycle consisting of 3 phases. What is the first phase? The first one, the evaluation, in which a baseline is established regarding the current level of inclusion of people with disabilities in the hospital preparation for emergency response and disaster, leading to creation of an action plan for continuous improvement in inclusion for disaster risk management. This is the first phase. What are the second? The phase of implementation. In this phase, it is subdivided into three instances. The first one is actions of visibility and participation, aimed at improving the visibility and representation of people with disabilities in the hospital in the short term, like it's 30 days. Second is actions for autonomy, aimed at improving the conditions that allow people with disabilities to navigate the hospital autonomously in the medium and long term. And the third is actions to exchange response capabilities aimed at improving preparedness for response, primarily through the updating of emergency and disaster response plan procedures in the hospital, incorporating the specific needs of people with disabilities. Now, what is the third phase? The phase of verification, in which actions are established to assess the disability variable in the hospital emergency and disaster response plan through inclusive simulation exercises and drills. Next, please. Why is so important the implementation of the INGR IDH. It contributes to the fulfillment of the rights of persons with disabilities under the Convention of the Rights of Persons with Disabilities and other rights instruments. It also contributes to countries' efforts to strengthen health systems with a focus on inclusion and resilience. The third, it allows linking the work carried out by organizations of persons with disabilities in the construction of disaster risk management policies through highly participation mechanisms. And the last but not least, the UNDRR IDH is an important guiding tool to replicate this model integration of our methodologies and instruments for disaster risk reduction. Next, please. What are the partnerships for inclusion in DRR? Governments and international cooperation agencies should consider this participation of OPDs, the Organization of Persons with Disabilities. We, RIADIS, the Latin American Network of Organization of Persons with Disabilities, together with organizations or governmental organizations, are linking together to learn about good practices in inclusive health at the regional level. This risk management must be transversal to the contents of the International Convention of the Rights of Persons with Disabilities, the CRPD. Next, please. This implementation of the UNDRDH will contribute not only to fulfill the rights of persons with disabilities, but also to the effort of countries to have a safer, more inclusive, and resilient healthcare sector. We currently have several current countries in the Americas and the Caribbean have implemented this methodology since the 2018, which is Mexico, Peru, Ecuador, Colombia, Chile, Guatemala, Nicaragua, Honduras, Panama, and Dominican Republic. I will leave my presentation here, but highlighting a fact that I said previously. It is important to have governments working together with the Organization of Persons with Disabilities. Also, it is important to have a better attitude from the governments to continue to working together with governments and the social society. It is important to have this work joint in order to have a better response in these DRR settings. Let's work to have this together and to be co-responsive on this working. Thank you all. Thank you, Alex. I pass over to you. I give the reflection, just to finish. I give the reflection is highlighted to have a better attitude to persons with disabilities and to have our rights and to show them, to show all that we can and we do our things. Thank you very much, Alex.
Thank you, Juan Ángel. Now we'll proceed to the questions and answers. Thank you for all the questions that we have received. Due to the time, we'll address a couple of questions to Natalia and to Juan Ángel. I kindly ask you, please, Natalia and Juan Ángel, to stick to the maximum of 2 minutes for response and reflections. So I'll start with Juan Ángel, since you're here. Juan Ángel, why is so important the participation of persons with disabilities in the different stages of disaster risk management, especially in the health disaster risk management? Over to you, Juan Ángel.
Thank you, Alex. it is very important to have the participation of people with disabilities because we know our situations. We are the ones who are living the situations of people with disabilities. We face the barriers. We know what is the most important reasonable adjustments for us within the health sector, within the hospitals. And because if hospitals and decision makers take the leading of designing of these reasonable adjustments or any other things without persons with disability, they may face a lot of barriers. They may face a lot of things that are not currently working for people with disabilities. This work must be intersectional. This work must include a social movement of persons with disabilities.
Thank you, Juan Ángel. Natalia, in terms of the youth and disaster risk reduction, what are the benefits and importance of involving young people in disaster risk reduction, both at the community level and at the national and international level? Over to you, Natalia.
Thank you so much for the question. First of all, as I already said, young people are really need to be involved in those at all the levels because we bring new ideas and also new perspectives. And at the end, if we want to target also and to benefit the children and youth, we also need children and youth to be involved in the decision-making processes, in the design and the implementation and in the monitoring of the different actions, because at the end also the DRR actions will benefit and also aim to benefit the whole society, including children and youth. And if there are adults, if we also want to have different groups, then we also need to have youth voices and children voices.
Thank you, Natalia. In the same path, what are the main barriers or challenges that the Latin American network of young youth and DRR have identified as main barriers to face in their effective participation in disaster risk reduction, and how can they be overcome?
Yes, so also I show some graphics and some results of the survey, and one of the main things that we found as challenges and barriers is the lack of information, and also there is a gap of information that at the end there are many policies or plans, but at the end those different instruments don't get to the children and youth. So it is important to strengthen the communication and dissemination strategies to get to the whole society groups. Also, there is lack of recognition of the voice and also of the learns the experiences from young people to participate. So it is needed to increase the youth representation in the different spaces of decision making. Also, there is a lack of resources and opportunities to strengthen capacities in disaster risk reduction.
Thank you, Natalia. And turning over to Juan Ángel for the last question. In what ways can persons with disabilities be more affected compared to the general population during a health emergency or disaster phenomenon?
The most affected situation for us is for not to have the information, for not to have the access to information about emergencies in accessible formats for us. Maybe we are depending to others to give us the information, and maybe we have not receiving all of the training to be ready to face this situation and to have access to this training, to have access to all of the settings that are organized to face the situations. It is important to empower persons with disabilities and to have them in all of the preparedness of this situation. So if we can access to the information and we can be prepared to these situations, and also to have data about who we are, how many are of persons of disabilities, who are the persons with disabilities, where are we? It is important to have this information in order to implement better strategies, plans, in order to respond to this situation. But the most situation that we must face, it's to have the families also involved in these situations, but not leading the opinion of persons with disabilities, but to strengthen the participation of persons with disabilities. We do not want to have other persons to be our voices. We want to share the information. We want to be involved, and we want to be prepared.
Thank you, Juan Ángel. Thank you, Natalia. It brings us to the end of the session. I'd like to share with you some takeaways, some very strong messages, and I'd like to start with some key reflections, key messages from Natalia and Juan Ángel. Participation of youth and persons with disability is key. It's the only way to make it real, the whole of society approach. If we know who they are, where they are, and what do they need, we'll be able to address public policies in the right way. And also will contribute to disaster risk reduction, to improve health security, and of course, to strengthen the response to cities to any kind of emergencies and disasters by leaving no one behind in a real manner. I like also to share that to be better prepared for health emergencies, it is fundamental to follow a risk-based approach and understand the risks that communities are facing. There is also a need to invest in health emergency preparedness, addressing a broader scope of hazards and addressing underlying vulnerabilities through comprehensive, multisectoral, and whole of society mechanisms and inclusive approaches to ensure the full ownership and participation of communities in this process. Key mechanisms to operationalize these considerations at the national and subnational levels include development of integrated disaster risk reduction policies and multi-hazard, multisectoral emergency response plans based on the results of a systematic risk assessment process. We have highlighted the importance that cities and urban settings have, since they are complex in the way with unique characteristics, ranging from the high population density that often includes informal settlement to the roles of travel and trade, as well as the shifting and heterogeneous compositions. Comprehensive health security and health emergency preparedness and strengthening can only be achieved through truly whole of society, multisectoral and multi-stakeholders approaches. We believe that this training, today's session, is a really showcase of how the inclusion has to be in terms of training and preparedness as well. And local authorities and stakeholders operating at the local level, such as within cities, are the closest to the communities that we serve. Therefore, it is important to ensure that the whole of society and multi-sectoral approaches are also implemented at the local level. It is possible at the community level within cities. It is key to addressing vulnerabilities and serving the various groups that exist within city environments. Before ending the session, please note that session 4 will take place on Tuesday, 27th June, not Wednesday as previous sessions. Session 4 aims to inspire individuals and organizations to prevent future pandemics, respond effectively to crises, and engage young people and local communities in pandemic preparedness and response efforts. The goal is to promote peer-to-peer learning and motivate action for building a resilient future. The session will cover topics related to pandemic preparedness, including training and capacity development, global health equity, DRR awareness, and communication approaches and education. The panelists will discuss the need of a coordinated and collaborative response to pandemics, the role of technology, and the empowerment of youth and local communities in pandemic preparedness and response efforts. It is very important to mention that you have to attend at least 3 live sessions in the way to getting the certificate. And also please complete the feedback survey and the test at the end of 4 sessions. And you have to pass with a minimum score of 80%. Remember that the final exam is made available after session 4 of the training on the virtual training platform from 27 June onwards. To ensure your attendance is collected, you must join the training via the learning platform, and you will receive a weekly broadcast from the course organizers on the information of the upcoming sessions. Thank you very much again. Thank you, Adam, for sharing this moderation. Thank you to my colleagues from UNDRR GETI, UNOSSC, to WHO, Amy, that is here in our 13, as well the DRR and the multisectoral coordination mechanism as well. And of course, to my PAHO colleagues, Mariana, and Juan Carlos. And how now to thank Natalia, a leader on the youth and DRR, and of course, Juan Ángel, also a leader in the region in terms of inclusive disaster risk management. Thank you for the translators. Thank you for interpreters as well as sign language, and see you in the next session. Big hug from Washington, DC. And this is the end of our session. Thank you, Adam.